I have been sick for almost 2 years now, and I could not walk properly. I had to stop my studies.
Hi, myself Dr. Roshan Swarup Sharma, Senior Consultant, Department of Radiology and Intervention Radiology, Venkateshwar Hospital, Dwarka.
Myself Dr. Rohit Kataria, Attending Consultant in Department of Imaging and Intervention Radiology at Venkateshwar Hospital, Dwarka.
Today we are here to discuss an interesting case. It's a case of a 23-year-old male patient referred to us from Mauritius with history of pain and swelling in the right leg. Patient had a history of right leg trauma in the thigh region 2.5 years back, and after that patient developed DVT involving the right external iliac vein, right common femoral vein, and your inferior part of right inferior vena cava. So there is a long segment of DVT, so to say, blood clots involving these segments of the vein, and due to this the patient was unable to walk and was bedridden for last 2.5 years. So when we investigated, the CT venography was done, and the CT scan showed long segment of thrombus involving this segment, and its length is around 28 to 30 centimeter, and there was pain and swelling, edema was there, and patient was unable to walk, bedridden. So with my team we planned for a DSA of the patient along with the angioplasty and stenting. So we took the patient to the cath lab. So we did the DSA, the contrast study, directly by injecting the contrast in the vein, and what we observed, the vein was totally occluded, as it was present for 2.5 years of thrombus, totally occluded. Rarely we could aspirate few drops of blood from the involved segment. Then successively we dilate the vein with a balloon, so-called angioplasty. Then we put the stent over there in the involved segment. The length, 16 centimeter length, two stents, overlapping stents involving the total occluded segment. We covered the total occluded segment, and when we checked after doing all these things, the involved segment was totally opened up, and the contrast what we injected at last is going freely till the heart, and the patient has got relief from all its symptoms of swelling and pain. Previously the patient was unable to walk for few minutes. Now he is able to walk, moving around the corridor. The pain and swelling is subsided, and the patient is so happy with this procedure.
Hello, my name is Abdoul Wahhaab Ismael. I'm from Madagascar and I'm 23 years old. I have been sick for almost 2 years now. I had DVT. It's a sickness where my veins were clogged and it caused pains, swollen legs, and I could not walk properly. I had to stop my studies. I was already seeking for treatment in Madagascar. We consulted so many doctors, 3 or 4. I had treatment, but it did not work. And finally we decided to go to India in January 25 in Venkateshwar Hospital. And we met Dr. Roshan. He did some diagnosis and discovered the real sickness, that it was clogged from here to the leg. It was a serious and rare case, and he did some procedure and they cured it properly. Now I can walk, I don't have pain anymore, I don't have swollen legs. They cured it quickly and they were really efficient, and I want to thank him properly and thank everyone in the hospital, the nurse, all the doctors that help with diagnosis, everyone.